Today we have Samar Yunus, and she's going to talk to us about the importance of exercise during Ramadan. So stay tuned with us. I would like to just talk quickly about the benefits of exercise. Of course, exercise is very important for your skin, for your body, and for your fitness as well. Well, studies have proven that if you want to stay younger, you should exercise because exercise can increase the oxygenation in your body cells and it will actually remove some of the wrinkles out. As well, if you do have any medical conditions such as multiple sclerosis or psoriasis or any autoimmune disease, exercise can be really good for you because it can actually help reduce the symptoms and prevent the relapse of the disease. There are other benefits of exercise, especially for those with diabetes type 2 and hypertension as well. If you are a diabetic type 2 and you can't control your blood sugar, just try to exercise sometime because exercise can actually help you control your blood sugar to a really good level. Or if you are a hypertensive patient and you want just to lose some of those high blood pressure readings, just do some exercises and you'll have a lot of benefit in reducing a lot of those numbers, and you'll make your doctor happy as well. And now with Samar Yunus for our interview, so stay tuned. So I'd like to welcome you, Samar, here in our show, Healthy Ramadan, and of course it's a pleasure having you here in our show. So my first question is going to be, why is exercise important now in Ramadan?
Thank you for having me on the show. It's very important to talk about this topic. As you know, exercise is an important thing that everybody should do on a daily basis, and we shouldn't really change our daily habits in Ramadan. But my advice would be is not to start a new physical activity in Ramadan because the body is still not used to it. You're dehydrated, you're fasting, you're hungry. So it would be best to kind of continue with a light exercise program during Ramadan.
So what type of exercises do you recommend in Ramadan?
It's very important to remember that every little bit you do is extremely important for your body. So try to incorporate physical activity throughout your day, whether it is using the stairs instead of using the elevator, parking your car far, walking a little bit more. So it's extremely important to make yourself move better. And you have to remember, if you do go for Taraweeh prayers, this is one other way that you can actually think of exercise in Ramadan, because Taraweeh involves a lot of movement up and down and bending and all of that, and that's good exercise for the body as well. So we talked about increasing our daily physical activity by doing different things, by going to Taraweeh prayers. But as an organized exercise program, a structured exercise program, you should really do the three types of exercises, which is cardio exercises, where you increase your heart rate, muscle strengthening, and stretching the muscles. Now, I have to point out that if you are exercising in Ramadan and you are fasting, your body is dehydrated, I wouldn't advise that you do any muscle strengthening during the fasting hours. It's best to wait until you break your fast, maybe after even Taraweeh prayers. Cardio exercise, you can do light to moderate cardio exercises while you're fasting, preferably not to push yourself too much so you don't get too hydrated, or if you're a diabetic, then your blood glucose will go down, so you have to be careful with that. Stretching, on the other hand, is a very good type of exercise that you should do on a daily basis. It's very gentle, it's very light on the body, and it actually helps you feel better.
What advice do you have for people who want to exercise in Ramadan?
It's between the hours that you are non-fasting, the time that you break your fast to the time that you have suhoor. It's extremely important to replenish the water that your body needs throughout the day, that it lost all day because of fasting, because of the heat, because of maybe exercising, all of these things. So our advice is usually to try to drink maybe 8 to 10, even I would say 10 glasses of water a day, because of the fact that we live in Kuwait and it's really hot and you dehydrate even more. So that's the number one concern, is to make sure that you get the water in. And as far as food is concerned, I would advise that you definitely, if you are a diabetic, you need to follow the advice of your nutritionist. Your intake should be a balanced intake between carbohydrate, protein, and of course a little bit of fat that your body needs, as your nutritionist advised you, as your doctor advises you to do. A little hint there is that some kinds of food can actually make you dehydrated, can make you more thirsty. So pay attention not to eat too much of those foods that can make you more thirsty. And replenish with drinking more water before suhoor, of course. So just make sure that during the hours from the time you break your fast to the time to the time of suhoor, you need to make sure that you avoid the foods that can make you more thirsty or dehydrated, such as salty food, processed foods, junk food, and things like that. That will make your body need more water. So stay away from those and drink enough water to replenish the body.
So do you have any particular advice you want to give for those who are elderly or frail and they need some exercise? Do you have any advice for those people?
With old people, the main concern with them is many of them have arthritis, many of them could have osteoporosis, which is thinning of the bones, and of course that creates a lot of pain in their body. And we need to advise them to move more, because the less movement they do, the more pain they have in their body. So our advice to them is usually to do any kind of light activity that doesn't put a lot of strain on their body. So let's say even if it's increasing their walking throughout the day, or if they can have a little cycle, stationary bicycle, or even a little cycle that they can put while they're watching TV, they're actually moving their legs. We have many tools that we can show them how to use in order to keep some strength in their muscles and their arms and their shoulders. So there are light and easy ways to keep them moving, but I would usually advise that they check with a fitness trainer first before they try anything. I would like to add a point for diabetic patients that we worry about them getting dehydrated, so it's extremely important to watch their water intake after they break their fast. We worry about their blood glucose level dropping too low, so it's extremely important that they measure. If they're not going to work out in a place like the Asman Diabetes Institute, for example, they need to make sure that they measure their blood glucose level. If it's too low, then it's not a good idea for them to exercise, because that's going to bring their glucose even lower. And sometimes if it's lower than 3.3, then they definitely need to break their fast. And number one advice I would say is speak to your doctor before. If you're a diabetic and you want to fast and exercise, so speak to your doctor first to make sure that you are cleared for that. That's number one. Number two, if you're exercising while you're fasting and you're a diabetic, always choose a light to moderate activity. Never do any vigorous activity while you're fasting.
So what are the common mistakes made by people that puts them off exercise immediately?
People start to fast too soon. So for example, if I had not worked out, let's say in a year's time, and I decide I'm going to start working out, and I go and I push myself to the maximum limit, I do a vigorous activity, a very hard exercise, and I do that for an hour and a half. I do cardio, I do muscle training, I do all of that, and I really push myself. The next day I'm going to wake up in pain, sore, and the pain and the soreness can actually continue with me 2-3 days because I'm not ready for it. So I would advise people that when you start exercising, you have to start gradually. Like for example, if you want to start, let's say even as simple as a walking program, don't go for an hour walk right away. Make sure you start with a 10-minute walk and gradually increase that. Every week increase it, maybe like 15 minutes the next week, 20 minutes the third week. So it should be a gradual increase to the time that you do the physical activity, and the intensity of your physical activity should be gradually increased. Another reason why people could actually be put off from exercise is also if they're not familiar with the exercise that they're doing, they could be using the wrong technique, they could be using the wrong form, especially if we're doing weight training. We advise people to do weight training or strength training. It's an extremely important part of any exercise program, but I always tell people, if you don't know how to do that, please make sure you do it with a personal trainer or the fitness trainer at your gym. Make sure they spot you, make sure they teach you the technique, they teach you the form, because you can easily injure yourself. You can have a joint problem, tendon pulled, a muscle pulled, even things that could require surgery. So if you really want to protect yourself from sports injuries or injuries induced by exercise, then you really need to make sure that you know what you're doing. And the only way you can do that is if you are with a fitness trainer or with a personal trainer.
In general, can you tell us the benefits of exercise?
Exercise is very good for your health. One of the biggest reasons why a lot of people start to exercise is to lose weight. So that's like number one reason for people. Of course, I have to remind people that 70% of the way your body looks depends on what you eat, what you put into your mouth. 30% is really your exercise program. So weight loss, burning fat is one benefit of exercise. The other good benefits is that it strengthens your muscles, it strengthens your bones, it keeps you flexible, it strengthens the heart and the respiratory system as well, the lungs. It protects you from diseases, from especially chronic diseases such as diabetes, heart disease, high blood pressure. And if you do have diabetes, then exercise will help you manage your diabetes. Exercise also actually helps brain function. Your brain starts to function much better. You start to remember things better. You start to think better with more clarity. Also, it's the natural way to feel happy. So if you're feeling down, depressed, sad, angry, whatever, go up and down the stairs. Go up and down the stairs for a little bit, or maybe get on your bike or jump rope or any simple thing for 5-10 minutes, and then before you know it, you're feeling 100% better. And it helps you sleep better. That's another point, actually, that exercise helps you sleep better. So if you suffer from insomnia, try maybe working out every day for an hour.
Now for some advice from Summer Yunus on exercising in Ramadan. So stay tuned.
So we advise you to continue with your regular physical activity, especially the ones that you do during the non-fasting hours. I also would like to remind you that Taraweeh prayers is considered a physical activity. So if you go to Taraweeh prayers daily, then this is something you should probably continue doing. It's not advisable to fast while you are sick. So it's a good idea whenever you're sick to make sure you see the doctor, because fasting can affect your blood glucose levels as well. So definitely do not come to exercise while you're sick. Be sure to break your fast if your blood glucose level is lower than 3.3, and if it's lower than 3.9 and it's only the first few hours of the day. Also, another one is if it's high, if the blood glucose level is higher than 16.7, then make sure that you break your fast. Make your routine varied and do things that are fun to do. Do not seek a personal best performance during Ramadan. Take it as the month to slow down and to focus on light and moderate exercises. Do not perform weight training while fasting. It can create too much muscle breakdown, which can raise the level of your stress hormones, and that can interfere with muscle strengthening. Best time to do the weight training is usually after Taraweeh prayers. Best time to do cardio is usually, especially if it's for weight loss, it's usually after Taraweeh, after iftar, if you just had a very light iftar. So, and I would say an hour after iftar. Drink plenty of water between iftar and suhoor. You need to remember that your body needs to replenish the water that you lost throughout the day.
Thank you so much, Summer Yunus, for being here on our show. And I would like also to thank Desman Diabetes Institute for just sharing their gym with us today. And of course, I'll thank you, dear viewers, for watching us. And don't forget to exercise in Ramadan. See you later.